Hey guys, let's talk a little bit more about peripheral sensitization. Something that I think is really important to grasp and understand because particularly in the foot, it's something I see quite a lot. Initially, let's talk about a definition, and it's really defined as that increased responsiveness and reduced threshold of nociceptive neurons in the periphery to the stimulation of their receptive fields. So consider that the nociceptive terminals have a greater quantity of the chemical mediator, which is stimulating the sensation of pain more frequently. Those action potentials, they're more likely to be stimulated, which we then cause that nociceptive feedback, which we then experience pain. Okay, now this is in contrast to central sensitization, where there is a recruitment of the surrounding neurons to provide a greater field of receptivity. And have a bit of a look at our video on central sensitization so that you get a bit of an understanding of where the difference lies as well. But with peripheral sensitization, chemical mediated, that's what we're looking at there. And with increased inflammation, with increased amount of chemical mediated receptors in that area, it's going to be a lot more pain that our patients might be experiencing. But how does it work? So it's initiated when the peripheral terminus of the nociceptors are exposed to that noxious stimulus. For example, inflammatory mediators, as I mentioned, in damaged tissue. Ongoing stimulation results in a lowering of the activation threshold of those action potentials and thus an increase in the responsiveness of nociceptors. Now, this can be summarized into about 4 aspects. The first one being enhanced sensitivity. So those peripheral nerves become more sensitive to stimuli, including touch and pressure. That, really, quite sensitive, hypersensitive type of appearance there. Then we're going to be finding increased pain signals. So the nerves send that amplified pain messages to the spinal cord and brain, which we then know that we then perceive and experience pain from. And then inflammation, the release of those inflammatory substances aggravates nerve endings, and that's going to intensify pain again. And it's going to get stuck in this cycle that is going to cause more pain. And as a result, we then get that altered response being our 4th aspect, where normal sensations may trigger pain, leading to hypersensitivity in those affected areas. Now, this is something that's pretty common for a lot of people, I imagine. They see it quite a lot. And that hypersensitivity following an injury is that important preservation mechanism. It allows the injured tissue to heal and to continuously warn and remind the brain to avoid further injury to this area. And that's a very normal process. But when hypersensitivity occurs, that can be prolonged, the body increases its sensitivity to the chemical mediators, or there is a decreased threshold. Now that's when you might be moving into a peripheral sensitization. And peripheral sensitization manifests its symptoms similarly to central sensitization, but exhibits more heat sensitivity. So people will experience burning more commonly. And I always say that when people come in saying, "Oh, I've got burning pain," I stop them right then and I say, "Oh, that's great," because it means that it's very local. It's this chemical mediated peripheral sensitization. It means that I'm more likely to be able to fix it at the feet where it's chemically mediated, and I just need to be able to change that around a bit. And again, central sensitization amplifies the signal with lower pain thresholds, whilst peripheral sensitization increases the sensitivity of the nerves. And that's a bit of the difference there. They're quite similar, but really that peripheral sensitization, you're looking for that burning, that chemical mediated broader pain that's local to the foot. Now, where does this fit into clinical practice? I've already mentioned it. The burning pain is very commonly reported in things like plantar heel pain syndrome, calcaneal nerve entrapments. It could be with the Achilles tendinopathies. It could be with some of our tarsometatarsal joint or midfoot, dorsal, top of the foot joint pains. And that's what we're looking at. And for me, if I've got a bit of an idea that this might be a peripheral sensitization that's occurring, I'm going to start using things like laser therapies or prolotherapies or high volume local anesthetic hydrodissection therapies, which are going to help to change the makeup of the chemicals and what's happening locally there, so I can start to change how that pain's perceived. Sometimes even just a really nice total ankle block with a longer duration local anesthetic is really going to provide what the brain needs to sort of change how it's perceiving those signals, but also to just stop those signals as well. But this has been a little bit on peripheral sensitization. Hopefully you've got a bit of information. Please put your comments down and let's have a bit of a further chat about it. Cheers.